My name is Matthew Cruz. I live in Bakersfield, California, in the 20th Congressional District in California. I was born in East St. Louis, Illinois, which is now a city that is 99.9% black. It is a city that, for a long time, has lived way below the poverty line, and most people there do not have the privilege of having preventative health care or even health care when they become seriously ill. I visited there this summer and I found nothing new. In fact, things were even worse. Because of my upbringing in East St. Louis, I always had a desire to help other people. And through my service in the military, which started in 1954 and ended in 1974, with 3 tours in Vietnam, I was able to see third world living conditions from a first-hand point of view. It only helped me in my desire to continue to try and help people who could not help themselves. Since I have lived here in Bakersfield, I came in 1978 and obtained a job with our county hospital system and acted as the collections officer. My official title was Vice President of Services and Collections. My job was to obtain money from people who did not have money, and because it reminded me so much of my childhood in East St. Louis, I simply could not continue to do the job and resigned after 3 years on the job. Began to work in business for myself and always was trying to find men and women who needed a job and who needed health care. The cost was exorbitant, but most of the time, all the people who worked for us had some sort of health care. It was always important to me, and I found how it was so much more in a personal way when I contacted, first of all, prostate cancer, which was something that was new to me and was able to overcome that. And then contacted valley fever, which is something that is only found in Kern County in California and in some states in Arizona and New Mexico. It's during that time that I learned that my wife, who had been a nurse for 35 years and worked and took care of people at many of the hospitals here in Bakersfield, found that she needed to have a hip replacement. It seemed just crazy to me that I had to, after looking at the possible costs to me, out-of-pocket costs, that I would have to pay after her allowable deductions, that I considered and am considering going to India to have her surgery done because even including the cost of airfare and the hotel rooms and all the other things that are connected with such a trip, our out-of-pocket costs would be a lot less. So, as I sit here today looking at what is going on in our country and trying to figure out how I can help, it seems to me that those who have the power to make this change need to do so and make it equitable for all people, that health care simply becomes a human right